Come on in. Today our guest is Dr. Liz, and she keeps a lot of people's feet feeling good and functioning well, but sometimes her work takes a toll on her. And so tell us what you're hoping we can help you with today.
Today it's my lower back. Just from bending, I see a lot of patients in nursing homes and wheelchairs, so it takes a toll on my back. And
A lot of odd angles and a lot of weird positions?
Yes.
Okay. We have met before, and usually it's something about her back. Not terribly often, but just keep her going. And so we'll see what we get into. I'm Kara Lindell, and I'm the founder of the Bridging Institute and the Bridging Technique. And I'm also an engineer and movement specialist. So today we're going to use an engineering-based problem-solving process to see what the heck is going on. We're looking for, in the physics of the body, how the little micro movements flow and transition and where they may be asymmetric or, in your case, stuck.
Yes.
So see what's off. And then the bridging technique is what we'll use to put things back together, and that is just a series of gentle movements and stretches that follow an early developmental framework, and that resets the muscles so that you're up and going and feeling better. So let's get to work. I'm going to let you take a step forward, and I'm just going to check how you're moving, the whole of you. So we're going to see if left and right. And please let me know if anything hurts. So have you tried anything to help with this already?
I have a massage gun that I've been using. I went to the chiropractor. The first couple of times it was better, and then the last time I was worse than when I first started.
Oh dear. So what I'm noticing is that just the overall movements of forward, back, side to side, and turning, if I am at your shoulder testing it, they're very sluggish, guarded. But if I'm down at your hip, they're fine. Okay. Which then narrows down things that it is something between shoulders and hips. So that does match with whatever's impacted is actually in your core. Are you comfortable sitting?
Yes.
Okay, sit. Let's see if we still have movement when you're sitting. And okay, the answer to that is no. So as we're working, what we are going to want to do is have your legs long, not flexed up, because there's something with your legs flexed that really just locks your core up. So and to think about your work, you're sitting, doing it. Yes. So yeah, something. We are not going to work on you the way that everything's jammed up. We want to start from where it's moving and then open up. So when we're done, hopefully when you're sitting, you're going to be able to move. Great. I'm going to let you lay down on your back over here. And let's just check and make sure legs are good. So they move easily in several different directions. And at the lower body. Okay, does any of that hurt?
A little bit in the lower back, but that's where the problem is.
Okay, I'll do that a little more carefully. And let's see how ribs are moving. Right side, not so much. Okay, so the other thing that we know about Liz is she's just had a lot of little things and a couple big things happen over the years. There is one surgery in core, so maybe that is also playing a little role in things, but we'll still see how things are coming together. Shoulder is nice, and make sure this one, good. Are you able to bend knees and hold and grab, or is that going to hurt?
I can do that.
Okay, bend them.
I think that's one of the stretches I do.
Oh, does it feel good? Okay. Okay, but nothing, you're not moving. Okay, so that helps lengthen your back. And, whoa, slowly putting those down. I'm going to just easy turn you toward me. Okay, and I feel like right in this area that does not want to move. Your shoulder does want to move, so that's good. And then let's see this side. Oh yeah, that's not going to move. I'm not trying very hard to pull to make it because we're not forcing anything. There are things that I normally check with somebody on their stomach. you don't want to go there because, at least not now, because you've got some pain going on.
Okay.
So let's see what angle actually is okay with your legs, because fully bent is not. I'm going to prop up legs so that they're at maybe 30, 45 degree angle. And let's see if we can get some core movement that way. And so I'm going to use the peanut to actually move both legs at the same time. And hips move on the right a little bit and the left quite a bit more. Does it feel okay?
Mm-hmm.
So we're going to use the direction that she moves and that feels okay to help recenter a group of muscles. So all the muscles in her core, we're just gently rocking. So I also know that you had some surgery down here. So we're just going to put some support here in case there's still a little something going on, even though it was several years ago. When we have abdominal surgery, there's a lot of layers that end up rearranging, some right afterwards and some over time. And here, what I'm looking for is that all of a sudden, or that she starts to move even easier from left to right. And that usually is an indicator that something in the whole balance between right and left was able to change. There we go. Here. Good? Mm-hmm. And then we're going to see how it comes from right to left. I'm going to go slowly. It moves. How does it feel?
A little sore on the left side.
All right. So we're going to come back and do just a little bit more. So what's different about just Liz's situation overall that we're working with today is she's currently in pain, not just some ache and soreness or stiffness. So we don't work with people in acute pain. This happened several weeks ago or more, 3 weeks ago. And so she's already done some basic things and ruled out that there's nothing really awful going on. So we're just trying to get everything matched back up so that she can get back in action. There. But this time I'm using the peanut ball as a support and using her leg directly as the lever from a physics term. And what just changed now is the rotation in your lower body linked up with ribs, like the upper half of your core. So we have more movement through your whole core. So let's see how it does from the right side. Love it. Yeah, so something happened with whatever you were working with at work, where if you think of the upper half of your core and the lower half of your core, that there's two parts that need to actually be in sync with each other, that they just got off center from each other. And, oh my gosh, that is so easy to move. Wow. All right.
Less pain.
Yeah. So tell you what, grab your knees again and let's see if you're able to move in your core. Yes. Any pain?
Less than before, but just a little bit in the lower back.
Okay. So we're going to let legs come down. So this is a bigger angle than what I was working, and knees are bent more. So I'm going to take you through the same rotation. So we're just covering a lot of different angles of how her legs and lower core and upper core work together. We're going to stick with the same direction of movement from left to right, because that's the one that seems to glue it all back together. There. So for you, and in the next few days, you may find that a stretch like this will actually be nice. Mm-hmm. And then you're going to say, oh, but I have to stretch both sides. No, you don't. There. Oh, super easy. Does any of that hurt? Mm-hmm. No, okay. Wow, but it's moving so easily. Whew. And so hold knees again. Let's see if this is even better. Yeah, even more motion. aches with that? Oh, good. Okay, so put them down. Let's see if we can move all of you. Oh, super easy. All right, and see the other side. Oh my gosh, I hardly had to try, and you just flow. Wow. Sit up. Let's see if your core is moving now. All right. So, oh, wow, look at that. So it's not quite centered. It's moving, but not centered. So I can go from right to left, but not really left to right. Let's see how turning. A lot more turn left to right, and that's the direction that we found was helpful. So I'm just going to hold the same turn and give a little wiggle to it, and that's what helps all the muscles rearrange. And then just a little stretch, and I'm going to do that 3 times because it's always a good number. And each time goes a little bit more into that rotation, and a little shimmy. And oh, now we're getting more turn to the right. And let's do one more time. I'm going to hold a little differently, connecting more ribs to pelvis and turning. That feels pretty centered. Just kind of coming up and making sure that as I go to different places that connect in at different levels of her core, that it's staying pretty nice and even. And so now testing right and left. So she even out on how her movement left and right is able to flow. So that was pretty nice. So stand up and let's see. How was that transition?
Better.
You didn't have to think about it. Okay, let's see. Wow. And okay, so to be fair, when I tested here before, I was moving better. It's better now, but the one that didn't move so easily is when I used your shoulders. And now it's not really any different than if I'm using your hips. Okay, any pain anywhere?
No.
Anything that you want to test? Let's start, okay. Wow.
I think so.
Okay, so just to summarize, Liz had lower back pain, probably from something at work where she overdid with weird angles that she gets into. And what we found is that when her legs were straight, her back was able to move better and not quite as tightened up. And when she was all flexed, it actually locked everything up. So we worked from an in-between angle and found that kind of the lower half of her core and the upper half were a little off kilter from each other. And using the motion that did work, we were able to link back in all the different segments, and then they recentered, and your back should be good to go.
Yes, thank you.
So again, we used an engineering-based root cause process to eliminate what was going on and work from there. We do teach this in our Bridging Basics course. And also, if you have an ache or pain that you'd like us to help you with, we'd love to meet you in our office in suburban Chicago. All the information is in the show notes. So give us a like and subscribe to the channel so you can see what other interesting cases we are able to help with. Thank you so much.
Thank you.